Hi, good morning. Today, as this is the most important topic, I'm going to discuss about diabetes, its treatment, prevention, cure, everything possible, and what all benefit you can take with natural treatment of diabetes. We'll discuss that also. So let's share my screen. Okay, so we'll start with diabetes. As far as me is concerned, I am a pharmacologist and ex-researcher. I had worked on basic herbs also while my research, and I have compared its effect with the allopathic medicines also nowadays. So it's best view that I can give you about it. Everybody knows what is diabetes, and today you know that the body diabetic means what? A body is unable to digest that glucose, and that glucose level in blood increases. So if something increases, it has a lot of side effects. That glucose, more glucose, can lead to many severe damages in your body. So how to control that glucose, we'll talk about. So today it is the major concern, because you know that there are deaths of diabetes which is increasing by 50% in the next 10 years. And it's like every other person, every 10 seconds someone dies with diabetes, and every year there is 3.5 million in world die due to diabetes. So this is all death and all. So people must think, when they are already treatment of diabetes, why people are dying, what is happening, why this can't control, or like, if I'm taking a medicine, I have to take it regularly. It's no treatment, it seems. It's only the day by day effect of that drug. And what is the drug doing? It's going into your system. It's uh, it is not that everything is activated of the drug molecule and is used. Some part is inactive also. It stays in your liver and kidney. It passes through it, and some part stays also. It causes lots of side effects later. We'll come to it. Now, first thing what I have to show is type 1 and type 2 diabetes. So here you see type 1 diabetes, which is insulin dependent, and type 2, which is non-insulin dependent. Type 1 means the person will be having less of insulin, mainly when a child is there, he's small, he'll be having this type of diabetes. The insulin will be less in the body. The secretion of insulin is less. If insulin is not there, who will metabolize the glucose? But what is type 1? Type 1, that can be managed with only insulin, it seems. It's difficult. But type 2 can be treated, it can be reversed. What is type 2? Why it happens? Why suddenly it happens mostly like in older ages, the person who's age of 40 years and adults. Why? Because there is no healthy eating, there is no physical activity, there is a lot of obesity, the stress level has increased in your body, and you are on other types of medicines, which is leading to this condition in your body. Your body is already on some other medication. Maybe you're having pain or something, you're having some NSAIDs, and your body is having more of exposure of chemicals, suppose. Because nowadays the health, the routine, the eating habit of a person has totally changed. The food is adulterated, it's not that much pure and organic which it was earlier. So the diabetes is also coming sooner and sooner, and it's more of genetic also. If your genes are there, you are more too prone to it, so you can stop it when you know that yes, you are prone to it. Isn't a good idea then to stop it later, and then you know use of it. You can't prevent that. It has to come. And when it comes, you have to treat it with a lot of medicines. So that's a thing we'll discuss. Now see here. Okay, what's happening? Second. Yeah. So here, if you see, this is how does the insulin work, the basic mechanism. Insulin acts like a starter. It unlocks the glucose channel. If it is not there, this channel will not open. This channel will remain closed. When insulin will come, this channel opens and glucose enters the cell. It is used by the cell. Now, if a person is diabetic, insulin may be not properly functioning or the amount is less and the glucose is not properly digested. So it is more in the bloodstream. It's more in your blood levels. Okay, to next, there are 5 types of diabetes. This side a little dull. So there is insulin dependent, non-insulin dependent. It is age-related diabetes, 39%. So people with higher ages have this, or it is obesity-related, 22%. So can't you control your weight? Because your weight, more lipid, exerts a more of pressure, more stress. These all are the symptoms which leads to decline of your insulin working capacity. This is type 1. Body does not produce, mostly because of genes or autoimmune factors. You get injections for the treatment, right? Type 2, you get symptoms like fatigue, numbness in hands, or even sometimes you get more of urination, and these are all you can reverse it with diet and exercise. आप उसे ठीक कर सकते हैं and आपको medication दी जाती है. Now, this is the diet which a diabetic person should follow. उसको सही से follow करना चाहिए. One thing is there, see if you check 1, 2, 3, 4, 5, at least 5 times a meal is shown in this diagram. This is a basic that is giving an idea of the calories which you should intake. The fat should be less. Now, from 1600, if you see, only 15 grams should be the fat. That should be less. Calcium should be more. Sodium is 1 gram only. 1000 mg means what? 1 gram. So sodium level should not be more. You should avoid that much of sodium. This is carbohydrate. Carbohydrate should also be controlled and watched. Which food intake leads to more of your glucose? You have to check it. Then protein. Protein should be good amount. It mostly your protein should requirement is like 1 gram per 1 kg body weight. तो आपका प्रोटीन अगर सही तरीके से नहीं है बॉडी में तो मेटाबॉलिज्म फास्ट नहीं होता है बॉडी का. So it's like 80 gram of the portion of every meal should be there. Meal should not be very much heavy. बहुत हेवी फूड नहीं खाना है आपको एक टाइम पे. थोड़ा थोड़ा खाना है, बॉडी को मेटाबोलाइज होने के लिए छोड़ना है. जितना आप थोड़ा थोड़ा खाएंगे बॉडी विल मेटाबोलाइज, स्टार्ट सिक्रेटिंग एंजाइम्स. आप लंबा ब्रेक दे दिए, फास्टिंग किए, व्हेन द बॉडी विल मेटाबोलाइज. उसको सिग्नल नहीं आ रहा है एंजाइम्स लिबरेट करने का, तो वो एंजाइम सिक्रीट नहीं करेगा. तो आपको लगता है वो इंसुलिन सिक्रीट करेगा उस वक्त? नहीं करेगा. आप ज्यादा फास्टिंग पे रह रहे कि आपकी बॉडी को प्रॉन करते हैं टू बी डायबिटिक. This is the fruits you can eat easily for diabetes. Cherries, grapefruit, apricot, pears, apples. This is GI score for every fruit. ये आप खा सकते हैं. स्ट्रॉबेरी, प्लम्स, ऑरेंजेस, पीचेस, ग्रेप्स. आप नोटिस करिए कि जनरली ये सारे फ्रूट्स मोस्टली खट्टे फ्रूट्स हैं. इट्स मोस्टली what is not sweet. It is not sweet. It is most of lemonish, orangish flavors, orange tip. थोड़ा सा खट्टे हैं, sour. So these type of fruits are good for your diabetes. not very sweet fruits are not good. So this is all good. It's not कि आप कुछ नहीं खा सकते, आप खा सकते हैं. इसमें आप include कर लीजिए kiwi, pomegranate, that is also good for you. Now, what are the drugs that our target is? I'm a pharmacologist. I have studies, and you know that even that in the market there are many of the drugs which are available for diabetes. Metformin, which acts on thiazolidinons, then glucosidase inhibitor, जो glucosidase enzyme को inhibit करके target करेंगे, या फिर sulfonylurea, urea, glimepiride and all, which act on this particular enzyme, या फिर it will be thiazolidine inhibitors जैसे metformin. So ये इन enzymes को target करते हैं so that it could somehow utilize your glucose or increase your insulin secretion. But what is there? That is sulfonylurease. If you study the mechanism, you know that it is close. It is somehow blocking this potassium channel, which lead to opening of more of calcium absorption and influx in your body, and helps in secretion of insulin. But there are various disadvantages of this. See, I'll show you. Okay, see, insulin, if given regularly for a person, he can have weight gain, that is okay. He can have insulin allergy also. You should have tested first this, or he could have lipodystrophy at injection site. Means वो lipid थोड़ा सा break हो जाएगा, वो layers break हो जाएंगी जब आप injection regularly लेते रहते हैं. Okay, so these drugs which are used all have side effects. If you see this glibenclamide, sulfonylurea, urea, glimepiride, ये सारे जो इस category में आते हैं, they cause weight gain. So person usually, if you see diabetic, mostly they have their weight gain. It's somehow related to the drug also, what they are taking for so many years. It leads to cardiovascular risk, rashes, and even bone marrow damage to your body. So it's not so safe. Do you think it is safe? Some like metformin cause sensitivity reaction or GI effects. So mostly these people will be having a lot of gastric issues because of these drugs which they are taking like regularly. DPP4 inhibitor saxagliptin causes pancreatitis, that is ulcer of the pancreas, or it also lead to risk of cancer and hepatic and kidney impairment. So would you risk your body like this for one drug you take and the other part of the body is giving problems? See, acarbose has hepatitis as allergy. So these are all, see, glycosuria, cardiovascular concern. These all will lower the glucose, glycemia, hypoglycemia, that's okay. But that can be maintained. But still the other effect, pancreatitis, hepatitis, or serious risk, bone marrow damage. Are you ready for all this? This is the things. Now we introduce a herb which is known as Glimnema sylvestria. That is in Hindi. In Sanskrit, it's called Madhunashini, popularly Mirasingi in Hindi, or milkweed the family is. What I'm saying is that we can treat these diabetic and pre-diabetic people with some herbs also, which could be natural. And that treatment will not have more side effects like that because it is from plants. And plants, as you know, you eat also them. This is not chemical, this is not synthesized, right? It goes in your body, it gets absorbed too. So the leaf, root or stem of the plant is to be used. See, this plant is used for anti-diabetic, weight loss, thinner, snake bite, anti-inflammatory property. ये कॉन्स्टिपेशन में भी काम आता है, जिन्हें आर्थराइटिस है उनके लिए भी हेल्पफुल है. Even in microbial infection or respiratory problem may be helpful here, and for cancer also it is useful. So you can think that this one plant has so many characteristics. अब आप कहेंगे ये गलत होगा शायद, आपके पास प्रूफ क्या है? So I'll say no, there is a mechanism of action like allopathic drugs. These herbs also have a mechanism of action. See here, so this gymnamic acid which is present in the herb, it decreases your ability of sweetness, sweet tasting जो आपका रहता है ना, उसको डिस्ट्रॉय कर देता है थोड़ा बहुत. यू डोंट फील लाइक कि ये बहुत स्वीट है, तो टेस्ट को, दैट इज द नेम इज मधु नाशनी, मधु को नाश करने वाला. तो आपको ऐसा नहीं लगेगा कि ये फूड बहुत ज्यादा मीठा है, मुझे टेम्पटिंग लगता है ना बार बार खाने को. उनको जो डायबिटिक होते हैं आप उनको देखो, दे वांट टू ईट मोर ऑफ शुगरी आइटम्स. व्हाई? इट्स बिकॉज कि उनका टेस्ट ऐसा हो जाता है कि कभी खाया नहीं, अभी और खाना है, अभी और खाना है. तो ये वैसी फीलिंग नहीं देता. इवन दे ईट ग्लूकोज, दे डोंट फील लाइक दैट मच शुगरी. एंड द बेसिक उसका मैकेनिज्म ये है कि ये प्रिवेंट करता है शुगर मॉलिक्यूल को एब्जॉर्प्शन बाय द इंटेस्टाइन. इंटेस्टाइन में शुगर मॉलिक्यूल ज्यादा एब्सॉर्ब नहीं हो पाते. That's how it lowers the glucose level or sugar level in your blood. So it also helps in secretion of insulin. It promotes your pancreas regeneration. It's very good for your pancreas. So therefore, if your sugar utilization by this intestine absorption is less, glucose is not absorbed in your blood, and it lowers the glucose level. It helps in a better pancreatic action. You can think it's supporting your overall system, and I already told you it's anti-inflammatory and it's anti-cancerous too. So it's so good that it is helping your system naturally, right? So what is the cause? See, the people are having obesity. उनको obesity होता है या cholesterol. तो ये जो acid है, gymnamic acid, it binds to triglycerides and cholesterol also to the receptors in the intestine and inhibit the absorption of them to treat obesity. So the person who is little bit obese, उसके लिए भी बहुत हेल्पफुल है, बिकॉज ये कोलेस्ट्रॉल ट्राइग्लिसराइड की बाइंडिंग को रिसेप्टर से स्टॉप कर रहा है. इट हेल्प्स, इट स्टॉप्स द एब्जॉर्प्शन. ओके, सो in short, if you see, it's very good. It inhibits the proliferation of the cells, cancerous cells, therefore it is anti-cancer. Also, it is having antimicrobial activity, so it is good for anti-inflammatory action in your body. Lastly, I will say that if you agree to me, if you agree that yeah, you have some problem in your body, or you tend to have because your genes tell like that, then there is a cure. There is a herbal cure for it, and you should not be afraid of diabetes. Have regular exercise, have good diet, control it, have less of sugar, less of sodium intake, less of salt intake, like that, and maintain. Okay, properly check. And for herbal treatment and other knowledge and more, if you want, you can contact me. My number is this 8951824462. Just note down. My name is Pooja, and you can definitely contact me whenever you feel like, and I can better suggest the guidance further, and I can assure you will help you with a proper treatment and a natural cure. Thank you guys. Thank you everyone for this wonderful session. Bye bye. Take care.